Rachel Hopkins.
Thank you, Mr Deputy Speaker. The breakdown of talks on NHS dentistry targets between NHS England and the General Dentist Practice Committee is a failure of leadership on the government's behalf. Government should intervene to reach agreement and alleviate concerns shared widely amongst our dedicated dental profession. And like others, I've been contacted by a dentist in my constituency who is very concerned that with the new COVID variant being highly transmissible and the national restrictions are locked down, it is, in their words, unfathomable that the government has chosen this time to introduce an increase in the target for activity required by dental practices holding an NHS contract by effectively more than doubling the minimum requirement of activity to 45%. I agree that with COVID rates still high, many patients will be understandably reluctant to go to the dentist. Indeed, British Dental Association analysis shows that over 20 million appointments were lost between March and November 2020, over half the typical treatment in a typical year. So I agree with my constituent who queries why are ministers encouraging potentially unsafe volumes of patients into NHS dentist practices under the imposed new activity targets. The imposition of severe penalties for not reaching these minimum targets will be untenable for many practices already struggling to meet additional costs due to COVID, and many will be at increased risk of closing for good. This would be a terrible situation for my constituents in Luton South, as Luton struggles with a very high level of poor oral health in our children, where the severity of tooth decay in children aged 5 years is above the national average at 4 teeth affected. Evidence suggests that deprivation accounts for 40% of the variation in levels of dental tooth decay. Children aged 5 years living in the most deprived areas of Luton have higher rates of tooth decay than their counterparts in the least deprived areas. They are 2.5 times more likely to have experienced dental decay. So if dental practices are forced to close, it will be harder for my constituents and their children to access the vital dental care they need. And the long-term impacts of poor oral health will not only affect people physically, but also psychologically, as it influences how they look, how they speak, eat, socialise. So as my honourable friend, the member for Putney, said, access to dental care must not become a middle-class luxury. So the current target and penalties are bad for practices and are bad for patients. And I urge the Minister to get back round the negotiating table and revisit the activity targets for January to April to protect our vital dental practices during the pandemic and provide them the support that they need.